This video will go over the proper technique for creating an ulnar gutter splint. This splint is used for immobilization of fractures and serious soft tissue injuries of the little and ring fingers and fractures of the neck, shaft, and base of the fourth and fifth metacarpals. First, gather all materials. You will need a bucket or basin with lukewarm water, web roll or soft cotton, stockinette if using, plaster of Paris of an appropriate length and width, an elastic bandage, plaster scissors, and tape. Some emergency departments do have prefabricated splints, but we will not be covering those in this video. If possible, use gowns or sheets to prevent soiling both the patient's and clinician's clothing, as well as the surroundings. First, place the web roll between the little and ring fingers to prevent maceration of the skin. Then apply the stockinette if you are using it. We did not use it in this video. Proceed with applying the web roll in a distal to proximal direction, taking care to not wrap it too tightly and to overlap each layer by 50%. Note that we are applying extra web roll to the bony prominences. Estimate the length of the plaster you will need by laying it next to the area to be splinted. Be generous as it does shrink slightly when dry, and if it's too long, it can easily be folded back at the edges. The width should be slightly greater than the diameter of the limb to be splinted. For our ulnar gutter splint, we can use a 3 or 4 inch wide plaster, depending on what is available in the department, and 6 to 8 layers depending on the patient's size. We will measure along the ulnar aspect of the forearm from just beyond the DIP of the little finger to the mid-forearm. This was done prior to cutting the plaster in our video. Submerge the plaster in the water until bubbling stops. Then gently squeeze out the water until the plaster is wet and sloppy. Place it over the web roll and gently smooth it over the extremity. Then you may fold back the underlying stockinette if you have used it. Note that the optimal water temperature for casting is lukewarm or slightly warmer than room temperature. Please note also that it's important not to get any plaster on bare skin, as it can cause a chemical burn and irritation upon drying. Secure the plaster over the extremity by loosely wrapping an elastic bandage in a distal to proximal direction. Again, when rolling the elastic bandage, much like with the web roll, it's important not to wrap it too tightly to allow for swelling, as well as to overlap by 50% each time. Proceed with molding to the contour of the extremity. Note that the forearm is in neutral position, with the wrist in slight extension. The PIPs and the DIPs are in slight flexion, and the MCP is in flexion. For a metacarpal neck fracture, such as a boxer's fracture, you want the MCP flexed to 90 degrees. When molding, it is important to not apply pressure to the same area from both sides to try to reduce pressure on the skin underlying. Also, do try to use the palms more so than fingertips when molding. This does reduce pressure on the skin as well. Note that the wrist is in slight extension, the MCP joints are in 70 to 90 degrees of flexion, the PIPs are in 5 to 10 degrees of flexion, and the DIPs are also in 5 to 10 degrees of flexion. So just to recap, first you will gather your materials and measure and cut your plaster to size. You can then apply your stockinette, which was not used in today's video. Then apply the web roll, taking care to overlap 50% and not wrap too tightly. Then apply the plaster splint, followed by the elastic bandage, and finally mold the splint to the extremity.